Hi there, it's me, Dr. Daniel, and in this video, I wanted to discuss a few things related to blood sugar regulation and some of the dysfunctions that can happen with abnormal blood sugar, whether that's too much blood sugar, otherwise known as hyperglycemia, or too little blood sugar, otherwise known as hypoglycemia. So let's go ahead and get into it. First of all, let's review some of the statistics when it comes to blood sugar dysregulation. Unfortunately, most people just don't realize how significant not having normal blood sugar regulation is when we talk about chronic disease. There's all sorts of chronic conditions, whether this is uncontrolled inflammation, joint pain, brain fog, fatigue, so energetic problems, of course, weight, right? So whether it's an inability to gain weight or an inability to lose weight despite you trying to improve your diet. You have autoimmunity that could be related to this. There's multi-system organ problems that can develop, such as liver dysfunction, kidney dysfunction. So there's a lot of chronic conditions that ultimately are going to be influenced by blood sugar regulation. Very important to really understand that as a concept. Now, insulin resistance, which is an inability for your cells to utilize insulin, metabolic syndrome, which we're going to talk about in a little bit, and type 2 diabetes, all of these altogether have reached epidemic proportions. In the United States today, someone dies from diabetes-related causes every 10 seconds. It's pretty significant. Diabetes and cardiovascular disease worldwide have now outpaced infectious disease as the primary cause of mortality. So we now live in this environment where we are overfed, we lack appropriate movement, so we're not getting enough movement as a nutrient, and it is literally killing us, more so than any other time in history. And again, infectious disease used to be some of the leading causes of death worldwide. Now we find ourselves in this energy problem. The Centers for Disease Control and Prevention reports that 1 in 3 people are going to develop diabetes in his or her lifetime. And today, more than 30% of teenagers are now classified as pre-diabetic, and more than 50% of 45-year-olds or older are considered to be pre-diabetic. And what's ridiculous is that most people don't even realize that they're in that state. And most people will go to their doctor, they'll get analyzed by their doctor, even with blood chemistry, and they're not going to be told that they're pre-diabetic. It is very common for doctors to get this data, and if they know better, they're able to inform their patients, but unfortunately, they typically wait till somebody becomes diabetic before doing something about it, which is really just ridiculous. Now, this is important to understand. It is impossible for anybody suffering from a chronic disease or chronic condition to fully recover or move into a state of balance if they suffer from a chronic blood sugar disorder. What that means is that every single chronic health condition that you can think of is going to be negatively influenced by blood sugar regulation. And so this is a very, very important thing to understand, because if you're suffering from heart disease, if you have cancer, thyroid dysfunction, autoimmunity, if you have weight problems, rheumatoid arthritis, any of these conditions that I'm talking about, sleep disturbance, skin dysfunction, acne, any of these is going to be negatively influenced by blood sugar. So as a starting block, right, as a point in your care, you need to make sure that you get that under control. And this graphic here is really just designed to help you to understand some of the systemic, the global problems that are related to blood sugar dysregulation. Now, what are some symptoms of blood sugar dysregulation? So whether, again, it's too much blood sugar or too little. Fatigue, absolutely, energy is going to be a main issue. And ultimately, that's what we're talking about. Blood sugar is the primary currency that our cells utilize. It's the preferred energy source that our cells utilize for energy. And remember, your body is made up of billions of cells. These cells come together to create tissues. Tissues come together to create organs. Organs come together to create organ systems, and then organ systems make the organism you. So ultimately, at its most fundamental level, that cellular level, if your cells do not have the currency that they need to function, you're going to have big problems. And fatigue and energy and brain fog is absolutely a common symptom that almost everybody will say that they experience, and they're just not paying attention to something as simple as blood sugar regulation. Insomnia, sleep disturbance, this is another big one, especially for low blood sugar, hypoglycemics. People that experience frequent mood swings or irritability, if you find that you're just not, able to tolerate your children or your significant other, or the news really upsets you, these could be, again, signs of blood sugar dysregulation. That leads to anxiety and depression. Absolutely. Low blood sugar could exhibit signs of panic. You can get arrhythmias. Your heart can start to pound. You're going to get sweaty. So you'll experience, again, anxiety or panic, but it could be low blood sugar. Hair thinning, infertility or hormone imbalances, and then, of course, impaired metabolism, such as an inability to gain weight or an inability to lose weight. Now, really, ultimately, when we're talking about dysregulation or dysglycemia of blood sugar, imbalances in blood sugar, there is low blood sugar, hypoglycemia, and then there is high blood sugar, hyperglycemia. Hypoglycemia is whenever you have low blood sugar. That is going to result in less cellular glucose. Your cells are not going to have enough glucose to function. And if your cells don't have enough glucose, that is going to result in less ATP production. ATP, otherwise known as adenosine triphosphate, is really the energy that we end up using to function. On the other end, you can have too much blood sugar, which results in high cellular glucose, too much glucose, and that also results in low energy production or utilization. So both of these, whether it's hypo or hyper, too little or too much, is going to result in problems. Now, what are the clinical symptoms of low blood sugar? Well, fatigue between your meals. If you find that you're getting a lot of low energy between eating, that is absolutely a symptom. Crashes of energy, especially in the afternoon, let's say that afternoon slump between 2 to 4 p.m. Sugar cravings in the afternoon, or especially after dinner, if you find that you've got a lot of sugar cravings, that could be signs of hypoglycemia. Improved energy and function after you eat. So if you eat and you feel an increase in energy, and in fact, that's a very important clinical question that any doctor should always ask. There are 3 routes that you can follow after a meal. Either there's no change in your energy, or you ate and you feel satisfied and that's it. That's one route. Another route is you eat and you have increased energy. And then another one is you eat and you have low energy. Well, if you eat and you have increased energy, again, that could be an example of hypoglycemia. If you experience irritability, shakiness, and anxiety throughout the day, if you have bouts of mental fatigue and, like I said, mood swings, and then again, difficulty staying asleep, these are all signs, clinical signs and indicators of possible hypoglycemia. Now, what are some of the things that lead to hypoglycemia? Well, there's diet and lifestyle factors, and this would include things like missing meals frequently, avoiding snacks or going for long periods without eating, using high sugar snacks. So, let's say like you start to feel low energy and you get a Snickers bar, and that gives you a little bit of a boost, but it's not enough to satiate your body, right? It's not feeding your cells. Resorting to using caffeine or nicotine to either suppress your appetite or give you, energy. Eating sweets instead of an actual meal, right? Snacking on things rather than actually giving your body protein. A lack of fiber is also very, very important. If you're not getting enough fiber in your diet, then that could contribute to it. And then you could also overtrain without replenishing your body. So sometimes this is actually very common with a lot of athletes where they're working hard, or, the stereotypical 40-year-old female who's trying to lose weight and she's exercising and eating low calories, low carb maybe. She's actually driving herself into this dysfunction. So those are all the diet and lifestyle factors. And like I said, low blood sugar symptoms could be craving sweets, being irritable, depending on coffee, feeling lightheaded if your meals are missed, or having brain fog if your meals are missed, feeling jittery or shaky. And it's easy for us to think of other things, right, that those symptoms could be related to. But again, this could come back to something as basic as low blood sugar. And typically people they're going to come to me and they're going to say, I've got fatigue, I've got insomnia, depression, and mood disorders, which, by the way, benzodiazepines, Xanax, anti-anxiolytics or anti-anxiety medication, antidepressants. All of these compounds could actually be contributing to low blood sugar or even high blood sugar. So a lot of times, depression and mood disorders, people get treated because they're feeling that way. It could be because of blood sugar problems to begin with. And then the solution for that doctors typically give is an antidepressant or anti-anxiety medication, turns around and actually can contribute to the problem and make it even worse. Other symptoms would be infertility. If somebody's having problems getting pregnant, blood sugar dysregulation could absolutely be something that needs to be paid attention to there. Metabolism, if you have an inability to lose weight or gain weight, absolutely. Headaches and hormonal imbalances. These, again, are all fair game when it comes to clinical symptoms that could be related. Now, what is the opposite of that? What are the symptoms of hyperglycemia? Well, fatigue after meals. If you eat a meal and you find that your energy crashes, it could be because of insulin dysregulation, or your meal was too big. That's another reason. Impaired brain function after meals. If you just cannot think, if you can't calculate, if you have poor memory, if you can't carry on a normal conversation, these again is an indication of impaired glucose regulation. Sugar cravings after your meals could be a sign of hyperglycemia as well. Chronic inflammation, that's probably one of the best clinical symptoms and indicators. Somebody that just has global inflammation, their joints feel pain, their muscles are tender. These are signs of chronic inflammation, or especially if you see that your body's a little bit puffy. This is chronic inflammation that could be related to too much blood sugar. Frequent urination is another one. That's a big one. And then difficulty exercising, just not having the motivation, right? Or not feeling good when you're exercising. However, if you do push through that and you feel better after, that's a pretty good indicator that you're dealing with hyperglycemia. Now, what are some diet and lifestyle factors? Well, lack of physical activity, just not working your body enough. As animals, we were designed to be running around, hunting other animals, chasing deer, climbing rocks, picking berries, not sitting behind a computer, not sitting all day long or working at a desk job. We lack physical activity, and our body is not burning off blood sugar or free-floating fats the way that it was designed to because of it. So that leads to resistance, insulin resistance, or metabolic syndrome. Overeating. We absolutely live in a time where we consume too much food, and again, we're not getting enough physical activity, so that results in problems. We also live in a time where we have access to high sugar, high starchy snacks. We consume fruit in abundance, and fruits were prized possessions. I mean, these were things that you would find every now and then, not all the time. So fruit juice, smoothies, just consuming fruit, these high sugar, high starchy type snacks are not good. Social and pleasure eating. I mean, eating is a form of entertainment, and I love it. I think it's great, and we should all take advantage of that, but we do it too much, especially when we're, again, not eating the right types of foods or not getting enough good physical activity. There's also a dramatic drop in the amount of fiber in our diet. And then, again, this goes back to food products or the refining of our food. Symptoms, fatigue after meals, craving sweets during the day, eating sweets that, and it still doesn't resolve your cravings. You still want something. This is all signs of insulin resistance. And some of the chief clinical complaints are going to be energy problems, an inability to lose weight, weight loss resistance. Like I said, joint pain, muscle pain, just signs of inflammation, infertility, thinning hair, and hormone imbalances. These are all signs of too much blood sugar resulting in an insulin resistance. Now, what are some ways to begin the process of diagnosing or objectively measuring blood sugar regulation? Well, unfortunately, most people, when they go and they see their doctor for their annual exam, they're only going to get blood sugar, glucose measured, or maybe A1C hemoglobin. That's typically the only two markers that a lot of your primary care doctors are going to be looking at. But let's talk about this nonetheless. All of the markers that I would consider to be important if we're addressing just blood sugar, right? There's a lot of other markers, but if we're just talking about blood sugar, you want to get your fasting blood glucose. So in a fasted state, meaning 6 hours of no food, what is your blood sugar doing? A1C hemoglobin, this is a 3-month average of how well you've been managing blood sugar regulation. You can then take your fasting glucose and A1C, and there's a calculation that you can do known as the estimated average glucose. This is something that your doctor would have to spend time doing, and unfortunately, most doctors don't take that time to do that. It is very important to measure insulin. Insulin actually becomes dysfunctional or abnormal way before blood sugar and A1C. So it is entirely possible for you to go to your doctor orders blood sugar, A1C, comes back and they'll say, oh, it doesn't look too bad, everything's normal. Completely misses the fact that insulin could be dysfunctional simply because it wasn't measured. And like I said, a lot of times it becomes dysfunctional way before. So for years, 10, 15 years, you could go to your doctor every year, get told everything's fine. And the whole time insulin's creeping up higher and higher, indicating prediabetes or type 2 diabetes, and you don't know it. And for 10 or 15 years, you could have been working on preventing it rather than all of a sudden one day being told you're type 2 diabetic. So, always ask for these things. Ask for an insulin measurement. It's very important to be looking into that. C-peptide is an indication of pancreatic function. Our pancreas is an organ that releases insulin, helps to regulate that. And there's a number of conditions that could be resulting in pancreatic dysfunction. So it's important to look at C-peptide. That's a backup marker for insulin. There's another marker called 1,5-N-hydroglucitol, or glycomark. This is a backup marker that I use for A1C because there's a percentage of people within the population that are going to have just an abnormally high A1C. And if it's elevated, you could be told you're type 2 diabetic, but if your glycomark or the 1,5-N-hydroglucitol, if that is normal, then you're not dealing with that. So it's important to kind of look at some of these backup markers as well to confirm the story of what your biochemistry is saying. Fructosamine is a way to assess blood sugar regulation over the last 3 to 4 weeks. And then you've got a number of scores that are very important to calculate that, again, most doctors are just being lazy with their care and not doing this. HOMA2B is a beta cell or pancreatic score. HOMA2S is a way to assess insulin sensitivity. HOMA2IR is a way to assess insulin resistance. And then you have the quickie score. So this is what I would consider to be a more comprehensive way to assess blood sugar regulation. Now, like I said, there's more to the story. Liver function, so looking at your liver enzymes, lactate dehydrogenase, looking at your triglycerides, looking at your B vitamins, especially thiamine, looking at inflammation markers. All of these other markers are very important to consider within the context of blood sugar regulation as a whole. So it's not as simple as just measuring these and looking at them at face value. Now, what are some normal ranges? Well, first of all, for blood sugar, you want it to be between 75 to 85. A lot of times doctors are going to tell you you're fine if you're less than 100. And the reality is that if your blood sugar is routinely above 90, you're in a pre-diabetic status. And that increases your risk of developing type 2 diabetes over the next 10 years, upwards of 66%. So, if your blood sugar is constantly greater than 90, that's not normal, contrary to what most doctors might say. A healthy A1C is going to be between 4.8 to 5.5. The higher that goes, again, it's just a greater indicator of a risk of developing type 2 diabetes. Insulin, that should be less than 9. And this is a perfect example, actually, of a friend of mine whose doctor recently told him everything was okay with his blood sugar. I looked at his labs and they were far from being complete. I ordered the appropriate testing. Turns out he's got some insulin resistance. His insulin, fasting insulin, is greater than 20. His A1C is 5.8. Together, that is a very strong indicator of insulin resistance. His triglycerides were abnormal. So again, very important to be looking at all these things. C-peptide, you want that to be between 1.1 to 2.1. If C-peptide is very low, that is a very strong indicator of type 1 diabetes and or hypoglycemia, even if somebody has normal blood sugar whenever they have their blood drawn. So just a couple of examples of things that we want to be paying attention to there. Now, like I said, very important clinical question. If we're talking about normal glucose, functional hypoglycemia, so low blood sugar, and then insulin resistance, a way to tease that out is how do you feel after you eat? If you have no fatigue or no change in your energy after you eat, that's a normal glucose response. That's great. If you have increased energy after you eat, that is an indication of either true reactive hypoglycemia or a functional hypoglycemia, which is still abnormal. And then if you have fatigue after your meal, if your energy drops, Either the type of food you consumed is something your body doesn't like, you had too much food, your meal was too big, or you've got insulin resistance. So again, just kind of a summary of a couple of ways to tease that out. Now, what is the scale of blood sugar regulation? Well, beginning from normal right up at the top, we can talk about from normal all the way to the extreme. First, you'll find that people have what's called postprandial elevated glucose. What does that mean? That means that when you eat food, your blood sugar should go up. But if it goes really high, in fact, one of the easiest ways to measure this is to get a glucometer or a continuous glucose monitor. Check your blood sugar before you eat. Let's just say, for example, it's 90 before you have your meal, and then you eat, and then you're going to check your blood sugar 1 hour later. It may go up between 100 and 140, and then 2 hours later, it should actually come back down to baseline. So again, you check your blood sugar before you eat your meal, check your blood sugar 1 hour and 2 hours after, and see what that number's doing. If your blood sugar stays elevated, that's an elevated postprandial glucose measurement. So that's kind of the early indicator of dysfunctions. Like I said, it should be coming back down to normal. If you have insulin resistance, you're going to find that your blood sugar is routinely greater than 100, especially greater than 126. That is a very strong indicator. Again, fasted, if that's what your measurements are telling you, that's not normal. Metabolic syndrome, you're absolutely going to see elevations of blood sugar greater than 100, and you're also typically going to see really high triglycerides and low HDL. Diabetes, you're going to see blood sugar greater than 126 in a fasted state. Diabetes with advanced glycation end products. These are compounds that are inflammatory within the body, and they basically result because of too much blood sugar and inflammation. Typically, you're going to see an A1C hemoglobin measurement greater than 7. Eventually, you're going to see diabetes with clinically identifiable ages, which are basically evidence of destruction of your tissue. And this leads to things like kidney disease, kidney dysfunction, right? And that's like end stage right there. I mean, that's pretty much game over once you get to that point. And like I said, going from the green area, the safe area, all the way to the bottom one, there's so many people that are not being assessed appropriately. And literally, they go to their doctor, they might be at level 4 or 5 or 6 even, and they are going to be told that everything is okay, and that's so far from the truth. And wouldn't you want to know that you're in this stage so you can do something about it before you're at stage 7 or 8, for example? Of course. And so again, this is why I'm trying to send this message out. Now, when we talk about metabolic syndrome, most people have metabolic syndrome and don't even know they have it. So how do you know whether you have metabolic syndrome? If you have 3 or more of the following, if your blood pressure is higher than 130 over 85, that is one indicator. If you have a fasting blood sugar measurement over 100, if your waist is larger than 40 inches for men or larger than 35 inches for women, if your HDL cholesterol, which is the good cholesterol, if that is under 40, if it's too low in men or under 50 for women, that's an indicator. And then if your triglycerides are greater than 150. So again, if you have 3 or more of any of those, that's a pretty good indicator that you have metabolic syndrome. And why is that important? Well, metabolic syndrome, when we start to talk about the devastation of it, it really does start to become this global clinical dysfunction. You're definitely going to have fatigue after your meals. You're going to find that you need to take regular naps, especially after meals. You're going to have weight gain, and weight gain, of course, is going to increase your risk for a lot of other conditions. You're not going to be able to lose weight. You're going to have weight loss resistance. So these are, again, some of the clinical signs and symptoms. And like I said, there's a number of parameters that you can look at: elevated blood sugar, elevated triglycerides, especially if they're greater than your total cholesterol, elevated LDL, uric acid greater than 5.5, CRP, which is an inflammation marker. These are all the labs that you can use to assess for this. But what is the impact? Well, first of all the risk factors you can see over here that we just talked about: inflammation, triglycerides, HDL, being overweight. These are all the risk factors. Drugs and environmental toxicants. First of all, medications that people are prescribed regularly, these medications themselves contribute to metabolic dysfunction. So we are here in this environment where the cure is contributing to creating the disease. So you just keep yourself locked into this vicious cycle. You got to be very careful with some of these medications that people get prescribed. And then you have environmental pollutants. We know that whether it's ppm in the air, environmental compounds and chemicals in the air, the individuals that live in more polluted environments, they have a higher risk of metabolic syndrome, let's say, than somebody that lives in a cleaner environment. There's a number of chemicals, plastics, phthalates, BPA, a number of chemicals in our environment that contribute to this as well. And then you have all the diseases that are going to be related. So when we talk about the significance of metabolic syndrome, and when we talk about how there's so many people out there that have no idea that they're dealing with metabolic syndrome, they don't even know they have it, yet these are all the conditions that could be related to it. Neurological disorders, anxiety, depression, brain-based dysfunction, polycystic ovarian syndrome or hormone dysfunction that could lead to things like infertility, acne, weight loss resistance, cancer, that's a big one, cardiovascular disease. Those are the two leading causes of death, and it's all intimately connected. Metabolic syndrome, in fact, is the gateway to developing cancer or heart disease. Type 2 diabetes, again, these are all intimately connected. Your potential for having a stroke, which, by the way, most people think that cholesterol is the big risk factor there. Cholesterol isn't what causes strokes. Damage to your vascular system, the development of plaques in your artery because of advanced glycation end products due to high blood sugar and inflammation, that is what contributes to damage to your arteries. Environmental chemicals that cause damage to your arteries, medications that cause damage to your arteries, these are the things that are contributing to it. Not cholesterol. Cholesterol is actually the answer for inflammation. Cholesterol is a very potent anti-inflammatory. And so if somebody has high cholesterol, the question should be why? Why is your body trying to put out the fire? Where is the fire coming from? And correcting that is really what you want to focus on. And then finally, non-alcoholic fatty liver disease, which so many people have, and they, again, don't even realize that they're in this state of dysfunction. So this video, again, is just really intended to give you some high-level thoughts and overview of blood sugar regulation and try to help you to understand how important it is to make sure that your blood sugar is regulated. And these are things that you can do really on your own. You can invest in a glucometer. You can get a continuous glucose monitor. You can start monitoring what your blood sugar is doing based on the foods that you're eating and really begin to try to work on improving your diet and lifestyle factors that result in balanced blood sugar. And if you do that, you're going to see an improvement in all these other conditions that we know that could be related. Again, my name is Dr. Daniel, and I really hope that this message hits you and you understand it. If you have any questions, certainly feel free to reach out.